Okay, today we're going to demonstrate a new way of injecting Botox. It's called Microtox. So it's injected and does totally different things than Botox normally does. In the neck, Microtox or Microbotox helps smooth out the laxity in the skin, helps reduce the lines, but it's injected very superficially, and it has a shrink wrap effect on the skin by affecting the the muscle that contracts the hair follicles. It's called the erector pili muscle. So by injecting very superficially, we are sparing the deeper muscles, and it causes a shrink wrap effect. This can also be used around the eyes to lift up the eyes. It can be used around the eyes to tighten up the lower eyelid skin, also around the mouth in a very safe way. So today will be part one of a series on Microtox, and we will focus on the neck. It takes a few minutes, there's no downtime, and we'll demonstrate how we do this. Mark out the neck into 4 quadrants. Push it down a little bit. The injection technique is different. It's very close to the skin surface. And just like the name Microtox, tiny amounts in the skin, and you want to see a small bleb in the skin. If you're deeper, you won't see the bleb, and it's not going to affect that superficial muscle that gives you the shrink wrap effect. So normally this procedure takes about 3 to 5 minutes. I'm just going slower to demonstrate. In a second, I will have Stephanie, my physician's assistant, treat the other side. Again, it's one of us that usually does the treatment, but just to demonstrate the procedure. So you can see these little tiny blebs in the skin surface. Then the question is, well, how many units of Botox do we typically use? And on average, it's going to be about 20 units per quadrant, so 80 units. And and then the question is, well, what about cost? How do you make this cost effective? So just how the same way that we price liquid facelifts, if patients are having Botox for other parts, we will discount this. So it is affordable. Oftentimes the results kick in much faster than when you inject deeper into the muscles, and I've seen patients with instantaneous results. It lasts 3 to 4 months. The key to this technique is to stretch the skin out so that you can get that very superficial injection, which is about 1 centimeter apart. So this is a trademarked technique. There's special training that is required and certification. We're all done. The whole thing took about 2-3 minutes. And unlike traditional Botox techniques where it takes about 3 days to start to see something, 10 to 14 days for the full effect, you're definitely starting to see some shrink wrap effect, early effects with this. I don't think we really understand exactly how it works, why it works faster than other techniques, but the Microbotox technique will give some patients oftentimes an instant result.